Katnat kakwat kakhia hne kasni kala aji hikai yikilar pathai khubor pa kynthup yaki kamram jongki haswa pan paidbah yaki dawai COVID-19 kablabu pan stang naduh ka khan riew tarik.
The government of India has done very visionary step was while taking the measures for containing this pandemic. Government of India also has actually invested in actually finding a solution through vaccination program, essentially investing in how actually we can produce a vaccine that can prevent and contain this this particular disease, which doesn't have basically essentially it's very infectious and doesn't have a kind of a solution except that we are dealing with isolation and some kind of a emergency critical care. So based on that, the government of India has come up with two vaccines have been authorized. I think you all are aware the two vaccines. One is Covishield and another is Covaxin. And these two vaccines are being distributed across the country. And we, Meghalaya, in the state of Meghalaya, we have got the Covishield in the first phase, 35,000 doses. And these 35,000 doses also are going to be distributed, in fact, in a manner that very systematically. In the first phase, we are covering the healthcare workers. That healthcare workers means healthcare workers both in the private sector and also the public sector. So we have about 27,000 healthcare workers are there in the state government domain. And then we also after the first phase we will be extending this vaccination drive to the frontline workers. Frontline workers includes the police and the municipal workers and and the disaster management people. So this is again the other second phase, and the third phase is for those above 50 years and those with comorbid conditions, because for them it is all the more important. So that's why the third phase is that. So this is the kind of a plan that has been put in across the country, not only in Meghalaya. So that is the way actually we are going to do this. But now today's meeting is essentially about talking about how this entire vaccination program is going to be rolled out. Why actually we do give vaccinations? Let us start with the fundamental starting point. If you look at it, see, in Meghalaya, we in fact last year we have achieved the vaccination program that actually we conduct for the children, because that's a very important thing. Many of the children die because because of many diseases which do not have a cure. Which do not have a cure. So vaccination is essentially something that for example polio. So polio we have eradicated. At least in Meghalaya there is no polio. So the vaccination program is that it is so important for the people to prevent from those diseases, especially which do not have a cure. So last year we had very good experience of actually vaccination program. In fact, Meghalaya was actually lagging behind in the full immunization of children at some point of time for various reasons. Then actually we started bringing that awareness among the people about the need for the immunization, need for the vaccination. So today actually we are one of the top performers in the country in terms of the full immunization coverage of the children below 1 year. So what I would like to say is that it is so important that awareness and the people's participation is very, very important. We have these vaccination sites across the state. We have about 6,900 vaccination sites. 6,900 vaccination sites, and our people actually every month they do the vaccination. They know how to do the vaccination. So basically we found last time we when we were reviewing why our immunization was low in the last year when we were reviewing, some of the things have come up basically people if you actually go to the village every month, definitely your vaccination is really good, because people can actually come to the vaccination site and it's easy for them, so they don't require to go out to the sub center or health center to get the vaccination. So that system is one thing that has helped us. Second thing is that, like, we also actually have to remove some of the misconceptions, some refusals, like, some misconceptions, because people feel that, okay, if my child is given the vaccination, my child got fever, so I'm worried about it. But actually, these are the things actually are common. Like, for that, like what we did, we gave this, paracetamol solution, like, that's the kind of a thing, and giving awareness, okay, if you get fever, do this. So that's it. Basically, it is essentially educating people about the entire nuances of the vaccination. That has helped us. Today 92% of 92% coverage. We are one of the, as I said, like after Kerala and Telangana, we are the state like with highest immunization coverage.